our Empowered podcast. And today we're going to talk about lipedema.
Lipedema.
Yeah, did you say it? Say it again.
With
you
the
got
I.
it.
Lipedema.
Yeah. So,
not, and this is different than lymphedema.
yes, and I'm going to explain all about that. So, this is right in my alley, right?
Yeah, it is in her alley.
Yeah, and the intention that I have, so we go into about what topics. She picked a topic, I pick a topic. Today I chose this topic because there's so many women with this disease not knowing is a disease and is struggling with the stigma of being overweight.
Yeah.
And the person use diets and do like so many things, and it's not a dieting problem. You can manage with an anti-inflammatory diet. We'll talk about all that stuff. So
I personally am going to have a lot of questions about this, and in preparation for this episode, because you're the expert on this subject matter, I said, well, how can I contribute to this episode? And so I'm gonna just briefly touch on the lipedema and the impacts with menopausal women, since I'm in menopause. And something that in my research, the connection between lipedema and menopause, and discovered that in women, during their phase of menopause, that the lipedema can worsen.
Yeah. Do you know why?
Due to the hormonal change. Well, yes, I discovered that it was the drop of there's no research that says specifically what it is, so I guess it's different for each individual, but there is a link between the drop of estrogen levels.
Yes, it's related to the hormonal imbalance.
Yeah. And so that was like, so I at first I had to keep rereading that because I was wondering, like, can lipedema be very, like, just in certain spots?
Yeah. So let me go and do a little bit of.
Well, let me before you jump in, because I know once you get started, you're going to be on a roll. But so key lifestyle changes to help with addressing lipedema during menopause.
Yeah.
So they basically said that anti-inflammatory diet and increasing the consumption of omega-3 rich foods. Does that sound, and correct me, because this is based on my research, not my professional opinion.
And spices like turmeric and ginger.
Yeah.
Well, I would like to create like some differences, because a lot of people confuses lymphedema with lipedema.
Right.
So edema is the swollen, okay? So this is a very good way to kind of save in your brain. Lipo is fat, is a word for fat. Lipedema is the swollen of the fat. Lymphedema is the swollen of the lymph nodes. So the lymphatic system, when it's interrupted, some surgery, which is very common for after breast cancer nowadays in the United States, is the leading cause of lymphedema, radiation. There's an interruption of the system, so the water, let's say the fluid doesn't flow regularly. Right. It gets accumulated in the tissue, producing the lymphedema. So usually that's like, this area got impacted, so this arm is going to be impacted.
Okay.
So that's lymphedema.
Right.
Lymphedema is like a trauma or a problem that happened in the lymphatic tissue or the lymphatic vessels, lymph nodes, that got the flow interrupted.
And if you want to know more on that, just watch our podcast on
lymphedema.
Yeah.
So today we're going to talk about lipedema. So lipedema is the swelling of the fat. So it's a connective tissue disease. The adipose tissue, which is the fat, it's a connective tissue. When you have growth of that, it's uncontrolled growth of the adipose tissue, is the lipedema. So think about it. Research has been shown that has a lot of correlation for hormonal imbalances, and it's like also it's passed from generation to generation in the DNA as well.
Oh,
it's like what do you call that?
Genetic
problem. So it's a disease. It's not just a condition. Okay, um, so the symptoms of that is both sides. So if I have, usually the most common one is the ties.
Yes.
And the Botox. So buttocks,
Buttocks.
your butts. And so that's like the most common one. And then the whole leg. How do you know it's not obesity? Obesity, it is lipodema.
Yeah.
Is because the foot doesn't get swollen. Well, so you have skinny foot with a big leg.
And let's for the purpose of a visual aid, Axel, if you would upload for lower body lipedema so that you can clearly see there's some swelling involved in that too. Yeah. If you'll just load that up for our viewers.
So that's like a very easy, one of the ways to look. One symptom is that you will have the hands or the foot very nice, like normal. The face would be normal. Usually the trunk is normal, but then you have like big legs or big arms.
Yeah.
Like today I had a client and she had like this part of the arm is normal. Her face is normal. Her foot is normal. But then this part, and in the ankle specifically, you can see like the ankle, like let's say here's the ankle, is like a bump. It's like a fat growth.
Yeah.
And the texture of that fat is different as well. So
what percentage of people are infected by this or impacted by lipedema?
You know what? I had the research and I don't remember. But I know it's more than people think about. It's a high number. There's 2 points about what I'm going to say is sad. The sadness is that a lot of people have it. They don't know they have it. They have been dealing with as obesity, including teenager girls.
Yeah.
The good thing is that in the last 10 years, a lot more researchers and a lot more medical professionals have been into this, this area of medicine. So you have a lot more resource. You have doctors who are specialized in lipedema. There's plastic surgeons that are specialized in lipedema. It's a different type of you do liposuction for both. Yeah. For obesity, body contouring, cosmetic, and you do for lipedema as well.
So if I had lipedema, let's just say in my thighs, and I were to undergo liposuction, does it rid the body of this issue and it doesn't come back, the lipedema, or
that you're gonna go into depending on your situation, and depending on it will depend on other items, not just. Okay, let me say what I have seen. I have seen people who, under management care, they are minimized from the coming back.
Okay.
And another symptom that is very important is pain. So lymphedema, expand, and there's no pain. Lipedema is very painful to the touch. So a common thing is that people cannot be touching their legs, people don't like massages.
Why is that? Why is pain associated with lipedema?
I'm not a specialist as a doctor, right? But from my understanding is because of the inflammation.
And the nerve endings.
The nerve ending is like full, when you have a pimple that is really painful because you have a lot of fluid and
the inflammation makes it sensitive. Yeah.
So I would say main thing you can look for to see if you have lipedema or not. But you always want to go check with the doctor, right? Mm-hmm. 1, is that painful? 2, is your extremities skinny?
Yeah.
And when you lose weight, do you lose weight just on your trunk, on your hands, or maybe on your arms, but your legs still the same? Yeah. It might be a little bit lower, but it's not the same.
Yeah. And I think also, recalling individuals with the lipedema in the thighs and the legs, they're kind of like, they have no formation, almost like trunks, some of them, you know what I mean? There's not because sometimes fat, when people gain, if it's fatty, just fatty tissue to the sense, it kind of sometimes gains evenly, there's still a silhouette, but all of a sudden something like you said, the shin and the calf very skinny, and then all of a sudden it starts to really widen and broaden.
Yeah, and it makes such an, imagine you walking around with like heavy legs.
Yeah, that's got to be uncomfortable.
You know, like if you had been pregnant, just that little bit of edema is already hard to move around with that baby. Imagine like you live with that heaviness. And there's another aggravant to that, because if it goes unattended and the growth of the tissue is expanding, it might cause a damage in the lymphatic system. Then the person has lipolymphedema.
Oh.
So, you know, and that is another aggravant. So, okay, ask me questions about like you being someone who's just like learning about that, and you've seen, what would you want to know?
Going back to the menopause, because I was curious about this, because with menopausal women and the lack of estrogen or testosterone or progesterone, we have weight gain. Mm-hmm. And so it made me curious as to, well, like, how does somebody identify that? And now you just kind of explained that. But also they were saying, you know, the anti-inflammatory diets, a way of managing it. So obviously it's more of like management, right? Not cure.
Eventually we want to do a podcast that we bring guests, and I will bring this guest. She is a client dear of mine. She has been dealing with lipedema for a while. She had the liposuction, and one curiosity that I want to bring it up about the menopause and the hormonal imbalance is that she was also pre-diabetic for a while, and she was taking Monjaro as a way of managing the diabetes and managing the weight loss, right? And she was managing the lipodema as well. She did liposuction, and she was not losing weight with the Monjaro. When she went to see a hormone specialist and she balances her hormonal thing, she lost the weight. Yeah. And this is after, you know, like the lipodema itself was being managed by a liposuction. She had the surgery, but the hormonal balance made the difference, not the weight loss.
Yeah. No, yeah, of course. That makes total sense.
Yeah. And then you asked something earlier. I'm sorry, I just remember about the pain. My experience that I have been seeing common is that when people do the liposuction and they take that fat that is kind of like that fat, the pain goes away. It reduces the pain, so alleviate the
Well, another thing, I mean, this is assuming, of course, but I would also think with this lipedema and lymphedema, the stretching of the skin is painful too, because when they're swelling
the lymphedema, no. The lymphedema, have you ever like hurt your ankle and you swollen very bad?
My father-in-law suffers from, you've serviced him before.
Oh, that's right.
And his skin is extremely stretched and it's very dry, and that's why here too, one of the things was keeping the skin well hydrated will help, because it does stretch and it starts to crack, and
so that's a different problem.
Of the skin
it's not the pain. It's not the pain. So there's two problems with there's a safety, it's called safety valve. I forgot the technical term, but your skin is elastic. It's like you just keep expanding. And eventually it gets too big, like the lymphangitis thing, that it start leaking and all that stuff. But you know, you can have stage 3 without any leaking. So it will expand. The lymphedema, which is the lymphatic problem, will not create pain. Now, the sluggish of the lymphatic system, because it's supposed to be detoxifying, the lymphatic is cleansing, removing waste. Because that is not being removed, the quality of the skin is no longer good. It's stale. You have prone for bacteria, you have prone for cellulitis, you have prone for damaged skin. So you will see, like, you know, flaking skin. You're gonna see keratin. I think that's the name, keratin on the skin. So that's a different problem that you have and it's because the lymphatic system is not cleansing.
So what you're saying is pain associated with both of these is not so much of when it appears the skin is hard like a rock and that's stretching. You're saying that that's not what's causing the pain.
There's no pain in lymphedema. This is what I'm saying. You might have pain because you have a crack ankle, a crack skin, and is frackle.
So I thought you said somebody was like, it was so painful to touch her.
Yes.
So what is that pain being? Where is it generating from?
It's the inflammation. So it's the lipedema is the pain. Lymphedema do not have pain.
Interesting.
Lipedema is because the tissue is full, it's inflamed. So that's why the anti-inflammatory diet is very effective.
Yeah.
I had a client today, she's doing the keto diet. So keto diet is one of the approaches to manage the inflammation in the tissue. And then you said like the turmeric, right?
Turmeric
and I want to remember that turmeric needs to be added with black pepper to be effective. So don't put just turmeric in your cooking. If you don't have black pepper, the liver will not really absorb.
Non-invasive treatments to address lipedema. It's going to take me a while to keep pronouncing.
Remember fat, lipo?
Yeah.
And then you say lipoedema.
Yeah.
Lipoedema.
Compression therapy.
Yeah. Well, the compression therapy is very like you can't put too much pressure, it's painful. But you want to create some kind of pressure to help alleviate and not stagnate the fluid. So the compression is stimulating. What is the compression is stimulate? Hold on, that I have here in my notes. You want to do the compression to improve the lymphatic flow. And also it's like to create constriction, so you force the body to keep moving the lymphatic flow, and then it keeps cleansing the inflammation, and
Okay. And then of course, again, referencing women in menopausal state that are dealing with lipedema, another thing is about skincare, because in my research, it does say that the skin can begin to crack, so keeping it very moisturized will also help to reduce the risk of infection.
Yeah, let me address this. So the problem that you talk about the skin is when you start having a compromised lymph system. So now you're not having the problem in the connective tissue, the adipose tissue, the fat. You also now have a problem in the lymphatic system. When you have a problem in the lymphatic system, then you're going to have the problems in the skin, and then keeping the moisture is very important. So when you have a problem in the lymphatic system, the cleansing is not happening, so it's more prone for bacteria, right? Mm-hmm. So cellulitis is a very common infection for people dealing with lipedema and lymphedema because of that.
Okay.
It's a very serious thing, so you have to really, if you have cellulitis, it's like, but you treat, and then management is the key.
Mm-hmm. Okay, so another thing too, red light therapy. My research indicated that red light therapy is growing rapidly in addressing overall all health issues, but actually highly effective in managing lymphedema.
Because it deals with the inflammation in the tissue.
The first and foremost of reducing the inflammation.
Mm-hmm. Yeah.
Because of its anti-inflammatory properties, also improving microcirculation and lymphatic flow.
Yeah.
That's what it said. And enhancing blood flow and liquid lymphatic drainage. Alleviates pain. So you're saying that there's no pain associated. No, the other way around. The other way around. Gotcha.
Yeah. So lipedema has pain, inflammation.
So it does show, research shows that it does help alleviate pain, and then it enhances skin health. by stimulating collagen production and skin cell rejuvenation. So potentially improving the texture and elasticity. So red light therapy, good to go to for this as well.
Yeah. Now, a lot of people are obese. They don't have lipedema. They have fat in their thighs, and they can also now treat it as a cellulite, right? So we can do another episode about cellulite, and you can use the same techniques for cellulite, because cellulite is also an inflammation of the tissue. You can use the red light therapy. You can reduce the inflammatory diet. So, and we didn't say that much, but the lymphatic drainage massage really helps with that too.
Yeah.
Let me go back with the lymphatic for the lipedema. So the lipedema has like some knots of fat. It's like a little clusters of fat inside, especially for those who are big. They're stage 2. They have like this nodules of fat.
Is it for visual purposes, is it accumulation of multiple fat cells that have coagulated together,
like a cluster,
and that are, or is it a multitude of enlarged fat cells that are beyond normal size?
It's fat cells with fibrotic tissue.
Okay, so it's a combination of both. Okay.
So, and
is it binded by fascia? What's happening?
Yes. So is the overgrowth of the tissue, the connective tissue that form the fat and holds the fat, and inflammation, and like.
So getting in there with that lymphatic massage is very beneficial.
Another myth is that you do lymphatic very light because it's painful. Well, you have to be thoughtful about the pain.
Yeah.
But you also need to be mindful to slowly get into it. I talk about like melting the butter, because what is butter? Butter is fat, right? When you have chunks of butter in your dough and you're melting, you're kind of dissolving, right? You're kind of liquefying. That's what you're really doing, helping with breaking down of the fibrotic tissue, that fascia that is involving that fat, and releasing the fluid. Because remember, now you have a lot of tissue, stagnation, your lymph node, like there's a combination of that the lymphatic massage with some kind of manipulation of that fat will release. So if you just do lymphatic very light, it will not get a relief.
There are so I've personally seen women. Do men suffer from some men?
No, it's a very rare in men.
Very rare, but some
it's
some
a woman.
Yeah. And my heart breaks. Right, my heart breaks for these individuals because they're dealing with pain, right? And they're dealing with
body image,
body dysmorphia, for sure. And they don't know that there's actual treatments out there that can help them.
And the stigma, right? Like creating that stigma that is my fault because I'm like trying to lose weight, and then I'm losing weight and it's not going away. And you go to the doctors in the past. You go to the doctor and the doctor's like, I have a. Oh my goodness! You just touched on a point that really what I want to talk about. This like, if you think you could have, go get a diagnostic. What do you say, diagnostic? Find doctors that do liposuction is specialized for lipedema. It's a different technique. The recovery is different. You got to take in consideration the pain, the inflammation. But I want to say another example I had. Bless the heart of this mother. She brought a 16-year-old to the office, and she had to go I think she went out of the country to do with Germany. I'm not sure right now, but she had to go to a specialist to do the liposuction on a minor. This girl was 16, and it got worse with the teenager. What do you call that? With the teenager years about changing hormones. But she was dealing with that since she was a kid. So like since 12, 13, she started having pain, getting obese being laughed at, they're put it on diets and everything, and it wasn't a diet problem. And then and then the mom, I think the mom was a lawyer, and she's like, you know what, I'm gonna believe in my daughter. I'm gonna go and look for resources, and I'm gonna go and look for solutions. And then she found out about the disease. That was just not. It wasn't a obesity problem. That was a disease. And then she went and she got the solution. And the girl is another teenager. I mean, her quality of life.
Do you remember what the solution was for her?
The surgery, liposuction.
Liposuction. And
well, she's also doing the exercising. She's doing the anti-inflammatory diet, but mostly was the liposuction.
So what? So I understand this, and if I was a listener, like, and I'm suffering from this, or I know somebody, so what you're saying is diet alone will not address the issues. Now, why is that? Why will diet? Because if diet and your caloric intake is less and you're exercising more, why aren't those particular fat cells shrinking? Is it because they're all binded up with?
There are different type of cells. They are. Again, I'm not a doctor in this. Okay.
Okay.
My understanding is the overgrowth of the fat tissue, and it's kind of like a dead kind of fat.
So you got to get rid of it. You need to suck
and
those
it's like
babies out.
a waste is the fat that is heavy over there, wasting, creating backflow, creating stagnation for the lymphatic system, having a weight on the regular tissue, on the muscle, so it's heavy, and the inflammation is the tissue is inflamed. And I would say also, you can think this way: when you have a weight problem, that fat expand and retract.
Right.
Whatever content is in that cell is released or is acquired, right?
Okay.
Hold it. If I have a lot of energy accumulated, my fat cells are big and have more content. If I'm releasing, I'm using that calorie, I'm releasing the waste, I'm releasing the fluid, then I'm losing the weight.
So let me ask you, since you're a provider of lymphatic drainage, if I were an individual and I suffered from this, and I did not want to undergo liposuction, be it financial reasons or just be it it's just not something
I believe a lot of insurance can cover, by the way.
Okay. How can you help me? What could you help me? Is there anything that you could offer at your practice?
Yes.
Okay.
And a lot of people are in stage 1, stage 0 and stage 1, which is very common diagnosis.
How many stages are there as far as
four stages. Yeah. And the picture we have it in there, it has like the 4 stages. The third is like really big, deformed. The 2 is very painful, it's big, but it's not as deformed. You start having fibrotic tissue. And then the number 1 is more like look like obese, like a big butt, a big thigh. But you see like, those like pear kind of shape. And then the 0, you start having some, like you diet, but you still don't lose the weight in certain areas, okay? Those are the stages. Ask me the question again.
So the question was, if I chose, like, because you basically said at some point, liposuction is essentially the only. Is there any other kind of technology that you have access to that can help remove these fat cells?
Usually, what I see is that when it gets to the stage 2 is when people get intervened, because it's so unbearable, the pain, the heaviness, that they start doing more research and they start finding out and they go to surgery. Okay. I know that people do liposuction in stage 0 and 1 thinking that they have a cosmetic issue.
Okay.
Now if they don't want to go under surgery, what I would recommend is to keep anti-inflammatory diet, do the detox, have your lymphatic system flushing, the inflammation, the extra fluid, and the massages really help with like working on that fat tissue.
Okay.
And I would add I don't offer red therapy in my office, but I would add the red light therapy.
You can come and see me for
Yeah.
red light therapy.
Yeah.
Wow. So what else do you want to touch on this subject? And is there,
Let me see my notes if there's anything I'm missing.
Something that we're forgetting about? This is like, it's interesting too, because I think I've actually experienced this a few times, not identifying it properly, like not seeing, and I would not know the different stages, like, because I'm not educated in this, but stage 1, stage 2. Would you personally be able to identify what stage a person's at just by the way that the body's formed?
A little bit.
Okay, yeah.
I wouldn't be the same as a doctor.
Yeah.
But like today I had a client who came in, she's like, oh, I have lymphedema. I saw her for the first time. She has been seeing somebody else who is on vacation.
Yeah.
And that person recommended her to me. And I was like, okay, tell me about it. I have lymphedema. And then she said, I have here, both arms, both legs. I was like, have you thought about this is lipedema? She's like, oh, I thought about it, but I never went to a doctor.
Yeah.
And I said, show me your foot. And her thin, skinny foot. And I said, does it hurt? She's like, yeah. And I said, well, I'm not a doctor, but you have lipedema. I mean, it's a typical, like today was a typical case of, and then I start working with her and kind of like with more pressure. And she's like, oh, the other therapist was very nice about it. And what you do is a little uncomfortable, but it feels good. Mm-hmm. It gets that relief, Yeah. So, anyway, I got distracted. I go on and on and on.
No,
so I really want, like, if you have any doubt, come talk to me. Like, I do free consultations, come get a massage with us, and you can have an experience. If you have some of those symptoms that I'm saying, if you have dealing with like weight loss and you lose weight and it keeps coming back, or those areas, like one thing she mentioned, she's doing a keto diet, and she mentioned that those areas reduce very little. She lose weight on her face, she lose weight on like her hands, but on the legs is a little bit. And I do think it's because she's in a keto diet, she's losing edema, she's losing inflammation. So when inflammation release, fluid release. Mm-hmm. So that area is going down a little bit, not necessarily fat going down, but fluid and inflammation going down.
Yeah. And what about some of the other technologies, cavitation, RF, lipolaser? Would any of those help remove those infected cells, as you say?
It's so hard to say that way, because the normal fat would be impacted by cavitation, by fat laser.
Okay.
This fat is different.
Okay.
It's a different type of fat.
All right.
Even like when you're trained, the way it texture is different.
Yeah.
Yeah.
The way what do you mean the texture?
The texture, skin? Like the fat underneath. Mm-hmm. Like when you're massaging something.
Yeah.
There's like you can tell when a muscle is tight, you can feel when the muscle is tight, right?
Okay.
When the muscle is relaxed. Yeah. The fat is kind of the same. Like when you're trained, you can feel the texture of the fat is different.
Do you kind of feel like you're also, it's like almost like scar tissue? Essentially, like I can feel scar tissue under the skin. It's
more like a bumpy,
it feels like
fibrotic.
Well, so
nose.
Scar tissue is very,
It's a combination of scar tissue with butter. Chunks of butter.
Let me visual. Okay. All right. Well, so this, you did dictate that this would be a short subject matter. Yeah. So, in summary, we'll just you had a wonderful little
and I have there's a few things that we always create treatment plans for whatever you want, health problems, post-surgery, lymphedema, lipedema. We always create a treatment plan, and I think it's very important that you have a management tools, not just one thing, right? So massage is a part of a plan, a treatment, and there's other things you can do to manage. So edema relief oil, we created this oil is specific for sluggish and congested lymphatic system. So people with lymphedema, lymphedema and lipodema, people with healthy body, but they are congested. They have congestion in their knees, congestion in their breast tissue, underarm. Like the edema oil is very helpful. So we recommend people to help with the lymphatic system for that healthy skin, for that health management of.
So addressing all of the side effects of this. And this is something that will increase circulation and blood flow.
And then I brought this on because this has guarana, which is a stimulant for the fat. So if the person doesn't really have the lipodema and it has more like a fat tightness, they can use the smoothing cellulite oil because it also have properties for the lymphatic system, but also help with the breakdown of the fat tissue. So this is like a very good, options for the lymphatic and the fat adipose tissue.
And we will feature these products on empoweredpodcast.org. That's our website where we feature products that we've talked about in our episodes.
The reason why we recommend.
Yeah.
Turmeric also, I didn't bring it in here, but turmeric capsules are very powerful for this. And detoxing, like diets, there are detoxing diets, detoxing tea, Lymph Bright has their own, but you have other good products in the market as well. So use it.
I have one other thing I want to share, but I'm going to wait to share that at the very end of this episode. If you want to share your quote.
Oh, my quote. We just need to be kinder to ourselves. If we treated ourselves the way we treated our best friend, can you imagine how much better off we would be?
Yeah, that's true.
Yeah.
So in a previous episode, we talked about the benefits of red light therapy, infrared. We also talked about it in this episode, how it could help with the therapy of management of lipedema. So one of the questions that came up was, hey, is it safe? I know when I go into the infrared spa, red light spa, like sauna, I'm not wearing protective eyewear like I notice you put on me when I'm doing it at your clinic. And I said, there are case studies out there that are showing that it's actually, they're showing benefits for eye health, overall eye health, blindness or vision loss. Just cut that out, that part about blindness, but vision loss. So I stumbled across this video of a mother and her infant child that had vision, issues, and they started exposing the child to red light and vision improvement over the years. So we're going to end this episode by sharing this video with all of you. I think it's significant, and I'm in love.
Yeah, and you will see the power of red light.
Yeah,
right.
So just embrace red light therapy and near infrared, like full-heartedly, and so.
And I know I read the quote, but I want to leave people with this.
Yeah.
We usually bring a lot of fun and jokes and everything, and I'm noticing we did not have too many things that we laugh and we bring it at. This is a very powerful subject and very painful for a lot of women.
Yes.
So I want you to, if you are relating to this, if you know someone, look for help. There's a ways you can manage this and can be really helpful, and you can have a better quality of life. And I really wanted to take advantage of that.
Yes. So with that being said, thank you for joining me today, and you guys, thank you for joining us. And we're going to exit with the video on the improvement of eyes with red light. Thank you, everybody. We'll see you guys next time.
Augustine has done red light therapy every day since he was 9 months old, and I'll tell you why. Augie has optic atrophy, meaning the nerve in his eye is dying and compromising his vision. This is because of his rare disease called Mitchell syndrome and its effects on the nerves. When we saw an ophthalmologist, he told me that there was no treatment for optic atrophy and nothing he could do. He could see his vision was compromised and he was sorry. I don't listen to any doctor that says that there's nothing they can do. It's not true, and doing nothing guarantees a negative outcome. So we saw a functional vision therapist out of pocket, and she was quick to recommend red light therapy and different vision exercises. So since then, Augustine does 10 minutes every day. I do it too. We do it together. His siblings do it. There's no side effects, and he loves it. I could turn it on, and he will notice it from across the room and crawl immediately towards it. He will sit the whole 10 minutes, plays with his toys on it. He gets upset when I turn it off. Red light increases energy production in the cells, reduces inflammation, and promotes cell repair. After 4 months of daily use, I went back to the same ophthalmologist for a checkup, and he was really surprised to report that Augustine's eyesight had improved. He was tracking better, and his visual impairment was so minor that he didn't even need glasses. We'll keep repeating tests, but I'd love to hear if you use red light therapy and if you noticed a change.